Hello, everyone. Welcome back to the Social Medicine Course podcast from the Albert Einstein College of Medicine up in the Bronx in New York City. My name is Wolfson-Stofko. I'm one of the lead organizers of the course, and I'll be your host. Today, our talk is being given by Dr. Fein, Professor of Clinical Medicine and Public Health at the Weill Cornell Medical College here in New York. He's also the chair of Physicians for a National Health Program, the New York Metro chapter. Today, his talk will explore the origins and accomplishments of the Lincoln Collective, which consisted of a group of residents at Lincoln Hospital in the South Bronx, community members, and the Young Lords. He will also reflect on how this movement was sparked by the social movements of the 1960s. And so, without further ado, Dr. Fein.
Well, I was asked to talk a little bit about the experience with the Lincoln Collective, and I wanted to do that tonight in a kind of different format than I've tried before, which is to tell you about the Lincoln Collective a little bit and what it did and what it was about, but then try to place it in the context of social movements in the 1960s and be a little bit more autobiographical so that you get a sense of what happened in that period. Again, I believe that it's important that you get disclosures, and I don't believe I have any relevant financial relationships to Lincoln Hospital, by the way, or to the South Bronx. But you should know that I am the chair of the New York Metro chapter, but as I have told audiences before, I have never been paid by PNHB. If anything, I have donated money to it. So what I'm going to try to do tonight is to start really with a little bit of a description of what was the Lincoln Collective, what did it do, how did it get there, and then talk briefly about what is a social movement, and then actually deal with these. Somehow they left off the fifth thing. Maybe that the women's movement should have been there. I don't mean to diminish it by it not being there. So let's start, and you have a sense about the South Bronx. I don't know if you do, but back in the 1960s, it probably had a 90% population that was from Puerto Rico and or African American. That shifted a little bit with the influx of the Dominican population to the present. It was and remains one of the poorest geographic areas in the United States, with back then very high rates of violent crime. And what was happening in the 60s and the 70s in the South Bronx is that many of the people who owned properties there actually set them on fire in order to collect the insurance. In other words, arson was truly remarkably high. There were 7 tracts in which 97% of the housing was burned to the ground. Can you imagine? And 44 tracts where over 50% were burned to the ground. And interestingly, I don't know if any of you have read Tom Wolfe's book, Bonfire of the Vanities. It actually was started in 1984, so it's a little bit later. But the principle behind it, or one of the principal episodes in it, is a couple that abandons their car in the South Bronx and experiences the very personal experience of being in a community that has such high violent crimes. Now, what about Lincoln Hospital? What's the history behind it? Well, it was founded in 1839 as the home for the colored aged. And then in 1882 became the Colored Home and Hospital, and was only named Lincoln Hospital in 1899 when it moved from Manhattan to the South Bronx on Southern Boulevard at 141st Street. In 1925, it was sold to the New York City Department of Public Welfare and became, in essence, one of close to 22 public hospitals in the city of New York. In 1960, Einstein became its academic affiliate, and that date I'm a little bit unsure about, but it's in the early 60s. And in 1975, it moved from Southern Boulevard there over to 149th Street, and you had the new Lincoln Hospital. Here's the picture of the old Lincoln Hospital on Southern Boulevard, and it gives you a sense of, it was an amazing building in some ways because it manufactured its own electricity when we got there, so that you had direct current coming out from the things. You had to be very careful not to plug your EKG machine into the regular, electricity from the hospital because you blow it up. It was one of probably the only buildings around that did that. And the Lincoln Collective, okay, how did it come about? Well, in 1969, around January, this young lady, happened to be my wife, a pediatrician, in her second year of residency, when we moved to New York, became the first really American medical graduate to join the pediatric residency program. She had interviewed up here with Lou Fraud and a whole bunch of other people for Jacobi, and they said, "Oh, you've got to come here." But when she went to the South Bronx, she said, this community really is interesting. And because she was there, she was able to attract a number of the Jacobi pediatric residents and got them to rotate down to Lincoln. And among them were some people who've become fairly well known today. Fitzhugh Mullen is in his first or second year of residency. Martin Stein, who's now out in San Diego. Michael Reif. A group of people came down, did a few months at Lincoln, and Charlotte persuaded them, to say, well, what we could do is let's try to create a residency program where there's a real social commitment, where there is a goal to provide community service and actually to try to build a much more non-hierarchical residency program, okay? And indeed, she was successful because here, by the way, is the Lincoln program in June of 1969. Interestingly, there's Charlotte. But the rest of the residents were actually almost all of them either from the Philippines or India. They were international medical graduates, excellent physicians, no question about it, but very used to kind of obeying orders that were given by this chap, Arnold Einhorn, who was the chief of pediatrics, who, was used to having everybody follow his orders. And here's some statistics on Lincoln that are really kind of fascinating when you look at them. 184,000 visits to their emergency room. This is one of the busiest emergency rooms in the United States. It beat out Bellevue, it beat out LA County in terms of the number of visits. Just an amazing experience. And you get a sense of the number of outpatient visits, 260,000, and the number of admissions, close to 10,000, 9,500. So what happened is that Charlotte and Fitz and Marty Stein, sent out a letter to, people graduating from medical school, people who were in residency programs and so on, and brought 30 new residents to Lincoln Hospital on July 1st, 1970. They didn't know it, but on July 14th, 1970, 2 weeks after they arrived, the Young Lords Party, which was a group of largely Puerto Rican activists in the community, drove up the emergency ramp of Lincoln Hospital at 4 in the morning in a U-Haul truck, if you can imagine this. And out came roughly 20 Young Lords people who took over the administrative control of the hospital. They went and took over where the major administrator was and so on and so forth. Fortunately, by 6 o'clock in the evening, they actually relinquished administrative control. But they had made their point. They were not arrested. There was fortunately no police violence in this. But it was an amazing development. They were arguing that health facilities should be controlled by the community control of health facilities. And during that summer, there was the death on the OB service of a young woman that people felt was really a problem. And there was a campaign that was not organized by the collective again, but much more by the Young Lords Party and another group called HRUM, which I'll describe later, and what they call the Think Lincoln campaign, in which they tried to hold, in fact, the OB service accountable for the death of this patient. Then, what happened was that the chair, Arnold Einhorn, by December began to have some problems with this renegade group of residents and literally decided he just couldn't control them and left the program. Was relieved, came up to Einstein actually, where he directed the intensive care unit. And in part that was because there was somebody in the Einstein administration, Louis Fraud, who was at least sympathetic to this resident program and was willing to give, felt that there was a mismatch between Arnold and the group of young residents that had taken over the program. And it is, when you think about it, absolutely an astounding event. Today, could you imagine a residency program being taken over by the residents? But that's really what happened at Lincoln. And by the spring of 1971, actually it was Helen Rodriguez was recruited from Puerto Rico, a very progressive pediatrician, to in fact become chair of the department. And in July of that year, the collective began to spread beyond pediatrics into medicine and also into psychiatry. Here was the kind of brochure that Charlotte and her team kind of put together using some kids' drawings about what it's like to come to Lincoln. So what were the reforms that this residency program actually tried to develop? And they were really, frankly, remarkably ahead of their time, because as I will show you, many of the things that they put into place have now been adopted. So they started with the notion of a non-hierarchical work relationship, so that they began to include on patient care rounds nurses and social workers, and everybody was given a chance to express their opinions about what was happening with patients. It turns out that, yes, they did talk a lot about politics, on rounds, so it wasn't just about patient care. In those days, some of them may have brought out what was called the Red Book, which was frankly a leftist politics approach. And they began to institute a much more systematic way of writing notes in the chart called the SOAP method. This is, I don't know if this is done at all here today, but subjective, objective assessment and plan as a way of writing your chart on an inpatient or an outpatient. It sounds pretty simple, but back then it was truly something very new. It was created by this guy Larry Weed, who had been one of our professors at Western Reserve, and therefore Charlotte and I were very involved with wanting to see that happen. I, by the way, was not at Lincoln at that time, and you'll learn why in a few minutes. So that was one aspect. Then they looked at the clinics, and clinics back in those days for residents operated in such a way that all the patients came at 9 o'clock in the morning or at 1 in the afternoon, and in essence, you saw, whomever lined up. You virtually never saw the same patient. I mean, unbelievable. So the collective said that's not a good way to deliver care. What we're going to do is, number one, have the residents in the clinic on assigned days, and they will build up a panel of patients. There will be continuity of care for the patients. Then they looked at the resident schedules, and I don't know if you have any sense, but back then it was absolutely routine that you would be on call 24 hours, right? So you'd be there for the entire night. You'd appear on morning rounds and sometimes fall asleep because, in fact, you were really bushed because you'd stayed up all night. And in a place like Lincoln, you got 50% of your admissions, after 10 o'clock at night. So you really were up. So they decided to institute a night float system, okay? A predecessor to the 80-hour work week, when you think about it today. In essence, nobody worked beyond 8 o'clock in the morning to 10 o'clock at night. You got a new team that came in, and that team worked from 10 until 8 or 9 the next morning. And then they began to institute some clinical practice guidelines, trying to develop some standardized ways of approaching health care. They developed in 1971-72 a thing called the Community Medical Corps. They actually trained people, largely with high school educations, to make home visits, to plant PPDs, to draw blood for anemia and lead poisoning screening, to literally get out into the community. Using to some degree the model that Mao Zedong had put into place in China called the barefoot doctors. And then finally they said, hey, who should be judging who's going to be a good resident in this program? Let's put some parents on the residency selection committee so that parents are actually interviewing new residents. So these were some of the amazing programs that were put into place by the collective. They then began to expand, as I said, in 1971 with medicine residents and psychiatry residents. They were very involved, many of them, with the Committee of Interns and Residents, a very new resident union that was formed, but was not just at Lincoln, it was really at all of the city hospitals ultimately. And then in the early 1970s, 1973, 74, New York entered its fiscal crisis. This is the time a little bit later, actually probably 75, 76, when President Ford refused to provide any federal dollars for New York, and there was the headline, Ford says to New York City, drop dead. I mean, that was in the Daily News. It was really an amazing thing. And reflecting some of this was a newsletter that we began to put out. I joined Lincoln around 1973 for medical residency, not pediatric residency. And we started the Temperatures Rising, kind of giving you a sense of things really moving along. Then in 1975, we moved to the new Lincoln Hospital. And then in 1977, actually Einstein was forced out of Lincoln. What Einstein had done is built North Central Bronx Hospital with bridges to Montefiore. You all are familiar with that. And the city had closed Fordham Hospital and Morrisania Hospitals, which had been affiliated to the Catholic healthcare network, essentially. And the Catholics said, oh no, now Einstein has all of the hospitals in the Bronx? No way. We're going to, in fact, force Einstein out of Lincoln. And I think Einstein wasn't too upset, frankly. It was a difficult place to be. And it became affiliated with New York Medical College, essentially, which was a Catholic institution. Here's Temperatures Rising, just to give you a sense, a lot of hair. This is me, and this wonderful scorecard, House Staff 1, Administration 0. A strong position on getting better working conditions. And just to give you a sense, this was the new Lincoln, and is the new Lincoln. It's actually a remarkable building that was put together. I think it's actually a very good building. So surprisingly, the fiscal crisis hadn't quite hit this structure. However, what was fascinating, Charlotte and I were just driving by the South Bronx, literally, on March 19th, 1977. And the old Lincoln was, it was a useless building. It was unbelievable. And so it was being torn down. And we stayed around just a little bit longer until literally there was nothing left. So what did the Lincoln Collective prefigure, essentially? Well, frankly, a much more patient-centered healthcare delivery system, and the continuity clinics, I think, illustrated that. Community engagement with health institutions, the whole territory of community control. Nowadays, people do timeouts. I don't know if you've seen that in your hospital at all, but the most effective timeout is when literally every member of the team, from the scrub nurse, to the nurse who hands the material, the instruments to the doctor, to the surgeon, to the resident, everybody actually is supposed to speak up. I think the SOAP format was a predecessor to the electronic medical record, which is increasingly dominating our hospitals. And yes, the night float system, really has now been adopted as an 80-hour work week here in the United States. So the question is, how is it possible that residents were able to take over and actually run a residency program the way they did at Lincoln? And I think it has a lot to do with the fact that there were social movements that actually influenced us all, as well as the society in general. So what is a social movement? Just as a definition, it is a collective challenge to elites, authorities, other groups, or cultural codes by people with common purposes and solidarity in a sustained interaction with those elites, opponents, and authorities. It is not typically a political party or an advocacy group. Is there any contemporary social movement that resembles this? Occupy, absolutely correct, I think. And this this is where this quote is taken from Sidney Tarrow, who's written this book, Power and Movement, Social Movements and Conscientious Politics. Oops. And he's a Cornell professor, but that's not. And the evolution of social movements in the United States, I think, is kind of interesting. If you go back to the 1930s, they tended to have an industrial focus, focusing essentially on materialist issues, such as the labor movement. The 1960s actually represented a little of the post-industrial focus, where you had a focus on human rights issues like civil rights, the women's movement, the gay rights movement. And here in the 21st century, I think we are beginning to see more of an integration, a focus on economic issues through the Occupy movement, the 99% versus the 1%, and some human rights issues. And I believe, frankly, the issue of access to health care is a potentially civil rights-like movement today. So these are the four movements that I'm going to focus on this afternoon to give you a sense, again, from a kind of more autobiographical point of view, how these things influenced us as we developed in the 1960s. So this is my journey, and it started actually in and during college. I grew up in a fairly traditional family. Both my parents were immigrants. Both of them had not gone to college. They were extremely grateful to be in this country, having escaped the Holocaust in Germany. Interestingly, ironically, I grew up in Yonkers, New York, right? Frankly, in a very public, integrated high school. Turns out I was kind of what they call president of the GO, the General Organization, but my vice president was Thomasina Deloche, an African-American woman. I'm not sure why, but I must have been truly naive, but I really didn't understand much about segregation in the South. And after my first year in college, I joined a kind of curious thing, a religious caravan that went from Pittsburgh, down to Charlottesville, Virginia, down to Raleigh, and then down to Chapel Hill. And I couldn't believe it. Separate waiting rooms in bus stations and train stations, separate parks, drinking fountains for colored versus, whites. It just blew my mind. But the worst part about it was that that's also what existed in the churches. And I came back from that absolutely, saying this has got to change. This has got to change. And sure enough, I was, here February 1st, 1960, were the Greensboro sit-ins. I don't know if you recall that, but these were 4 students that refused to get up from a lunch counter in a Woolworths and were arrested for that. And what it led to at the college that I was at Swarthmore College, was the Swarthmore Political Action Club. Okay, interestingly. And we decided to send a delegation down to the Student Nonviolent Coordinating Committee's first meeting in May of 1960. I didn't go to that meeting, but I did get to the second meeting in the fall of 1960 in Atlanta, Georgia, an amazing experience in which Martin Luther King debated with Ella Baker. Martin Luther King being the president of the Southern Christian Leadership Conference, right? Ella Baker, an African-American woman, being the executive director. And they were debating each other about what SNCC should do. Should it become the youth wing of the adult movement, the Southern Christian Leadership Conference, or should it remain independent? There were all sorts of interesting people. Probably the one that's best known today, John Lewis, a House of Representatives person today, was at that meeting and was part of SNCC, and SNCC decided not to become the youth wing of the Southern Christian Leadership Conference, but it was an amazing experience. And we came back from that experience, and 5 miles from Swarthmore was Chester, Pennsylvania. And yes, there was a Woolworth, so we started picketing the Woolworth, okay? And we learned then that there was a roller rink in Chester that was segregated. What? This is the North, we said. How could this be? Yeah, they had a white night and a black night. And we decided this is not going to continue. We are going to desegregate the roller rink. And yes, we did. It was a complex experience, to tell you the truth, because there weren't very many African American students at Swarthmore in those days. We had a few true Africans, you know, people from Nigeria, from Ghana, and probably only one in our class, my class, that was an African American. It's absolutely astounding. Well, it turned out that we had a few people that were working in the dining room, and the dining room was in fact staffed by, you know, African Americans from Chester. And we persuaded them to join us in trying to integrate the roller rink. And sure enough, we were able to go on a black night, and so what? But there was quite a bit of tension when we went with them on the white night. And ultimately, they in fact stopped having white and black nights. Then in 1963, many of us actually went on the March on Washington, where King gave his I Have a Dream speech. And that's just this year been memorialized, I guess, with the 50th anniversary. Not this year, but just last year. So what happened? Here I was. I graduated from Swarthmore in 1962. Actually had not taken a chemistry course in my life, not even in high school, but had been accepted in graduate school for history and political science. And I said, you know, God, what am I going to do with a degree like that? I needed to develop a skill that could be put at use of the civil rights movement. And it's really that which generated my interest, in going to medical school. I was a scrub nurse that summer at Bellevue Hospital, something you could never do today. It's really amazing. And liked that experience a lot, and decided to go to Columbia General Studies to do my what people call post-bac today. Did my organic chemistry actually over the summer out in Cleveland, and had the serendipity that was really remarkable of somebody dropping out the day or two before classes open and getting that position offered to me, which probably wouldn't have happened instantly. So I started classes in '63 and then had the remarkable experience of being paired up for my dissections, and we actually did dog labs, things that you don't do today, but we actually operated on a live dog. Can you imagine that? Yeah. Right. And who was my lab partner? But David Satcher. Anyone heard that name? No. David Satcher, the 9th child of a sharecropper family from Alabama, African American. An amazing person who, under the Clinton administration, became our Surgeon General. Can you imagine? During my first year, there was a very active civil rights movement in Cleveland, arguing for the integration of the public school system. And sure enough, I went down and sat in at the Board of Ed, got arrested. The dean calls me in and says, "Listen, fine, you really want to go to medical school?" I said, "Yeah, that's why I'm here, but this thing is wrong, the segregation of schools." We were able to work it out, that I was able to stay. But I still remain very active, as you will see, in civil rights issues. And '64 was the famous Freedom Summer. This was the time at which actually the Medical Committee for Human Rights was formed, and a whole bunch of people went to the South. That is not what I did, as you will see in a few minutes. The other movement that was certainly very active at that time was the anti-war movement. In 1965, you had the first March on Washington, which was organized actually by students, by SDS, the Students for a Democratic Society. Paul Potter was the president at that time. It turns out he lived with us in Cleveland, as I will describe to you in a few minutes. Then a whole bunch of medical students got together and created the Medical Resistance Union, the MRU. By 1967, we had over 800 medical students who said, "We're not going to serve in the Army in Vietnam." My approach, some people, most of them, went into the public health service, which meant that you didn't have to literally do combat service. I was a little bit of a purist and said, well, frankly, the public health service people could be recruited to go to Vietnam, and I just did not feel it was right to do that, to patch up people so that they could in fact go back and kill other people or be killed themselves. So I took the position of a conscientious objector, which is unusual for physicians, because most conscientious objectors, as their alternative service, did what? They were medics, whether they were physicians or not. So I applied during my residency in Cleveland, my first year of residency, applied to become a conscientious objector. And a month, and that my draft board was the Yonkers draft board, and they granted me the CO status. I mean, we were just thrilled at that point. But a month later, the state draft board wrote us and said, you're not a conscientious objector. They did not, I think, want to see this president. And they sent me an induction order for September 6, 1968. Well, difficult situation, what to do? My parents, again, would not support me in this. They felt I should serve the country. Well, I decided I needed to find a lawyer, but just like many of you, we had a little bit of debt, for medical school, although nothing the size of your debt. And I really needed a pro bono lawyer, and finally interviewed this outfit, Berminowitz, Boudin, and Standard, and they said, this is an interesting case, because if we could apply, if the selective service system, which is set up with a local jury of your peers, and an appeal process and so on, set up like the judicial system in this country, the government is usually not allowed to appeal an innocent, if the jury judges you to be innocent, unless they have other grounds. So they thought, well, let's see if we could get this to apply to the selective service system. And sure enough, we went through the district court, had a split decision, went through the circuit court, had a split decision, and finally got to the Supreme Court. Fein against the United States. And in 1972, the court came down with its decision against me. And these were the justices in the minority. It was discouraging, but we were actually in 72 kind of coming to a place where the Vietnam War was declining. Up till then, I couldn't continue in residency. No residency program would take me because I could be, removed at any time. So, it's then in 72, the end of 72, the beginning of 73, that I returned to residency, and I did that at Lincoln Hospital. Well, what about the student movement? How did that influence us? In part, there was in 1960 the founding of the Student for a Democratic Society. Its Port Huron Statement in 1962, the creation, as I mentioned earlier, of the Swarthmore Political Action Club, which became a chapter after I graduated from Swarthmore, you will notice. But still, SDS was an important formative thing for me. And I just wanted to quote a few of the things from the Port Huron Statement to give you a flavor of this. This is student written, right? We are people of this generation bred in at least modest comfort, housed in universities, looking uncomfortably at the world we inherit. As we grew up, our comfort was penetrated by events too troubling to dismiss. First, the permeating and victimizing fact of human degradation symbolized by the Southern struggle against racial bigotry compelled most of us from silence to activism. Second, the enclosing fact of the Cold War, symbolized by the presence of the bomb, brought awareness that we ourselves and our friends and millions of abstract others might die at any time. We might deliberately ignore or avoid or fail to feel all other human problems, but not these two. For these were too immediate and crushing in their impact, too challenging in the demand that we as individuals take responsibility for encounter and resolution. And the bridge to political power will be built through genuine cooperation locally, nationally, and internationally between a new left of young people and an awakening community of allies. As Students for a Democratic Society, we are committed to stimulating this kind of social movement, this kind of vision and program in campus and community across the country, if we appear to seek the unattainable, as it has been said, then let it be known that we do so to avoid the unimaginable. It really gives you a sense of the flavor of this movement. So, what happened is that SDS in 1964 created a program that they called the Interracial Movement of the Poor. They were trying to find places for graduates of undergraduate school to do meaningful work, largely community organizing. And in 1964, they formed the Economic Research and Action Project, which had satellites throughout the country, probably, if I recall correctly, about 9 different places. And one of those was Cleveland. Charlotte and I were not married until June of '64, but we decided to put in an application. She, by the way, came to medical school with me as first year class. I followed her. She's much smarter than me. And we decided actually to form this thing called the Economic Research and Action Project in the east side of Cleveland, the west side of Cleveland, which was a white community. And our idea was to try to bring white, working class, and poor people into an organization with African Americans in the civil rights movement on the west side, east side, rather. And so ERAP, in 1965, the fascinating thing is that we were quite successful in organizing this, but the African American community said, why are you students only in the white community, in the east side? You've got to come over to the African American community on the east side. And so actually, because the medical school was over there, it was a lot easier for us, Charlotte and I, to move to the east side, and that's what we did. This was also the date that the Student Health Organization was founded. There were incredible riots in Cleveland, as there were, in LA. These were called the Huff Riots within the black community. We graduated with a thesis dealing with a lot of our issues related to access to care, interestingly, and started our residency in '67 in Med Peds at Cleveland Metropolitan General Hospital, the MGH of the Midwest. It's a great place, actually. And during the summer of '68, we had the Cleveland Student Health Project. Just to give you a sense of the flavor of things, this was the group of people in the ERAP project. So it was really a wonderful place for us as a young couple to come back, from medical school studies to a group that was very engaged in the community. This is Paul Potter, who, as I mentioned, did the speech. And this is one of the community kids, Lillian Craig's son. She was on welfare. We organized her into a welfare rights group. We held a lot of long meetings. You can see, this is my wife Charlotte falling asleep in the meetings. Joan Bradbury, just kind of fascinating. A lot of demonstrations while we were in medical school, no rent for rats kind of thing. Organizing and dealing here with a lot of police response to things, a rally outside City Hall. Then during the Huff Riots, the National Guard was brought in. This was in our community, literally down the street from us, all these guns, and soldiers walking around. And I couldn't resist showing you this slide. One of the young African-American students that we organized, 16-year-old Linda Murray, ultimately ends up going to medical school and then becomes the president, actually, of the American Public Health Association about 2 years ago. That kind of wonderful continuity was just amazing. And then also in terms of students, what was fascinating was the creation of the Student Health Organization as an alternative to SAMA, the Student AMA. This is before AMSA was created. We created SHO. That started in '65. One of the principal people who organized that was Fitzhugh Mullen. So resident that Charlotte convinced to come down to Lincoln from Jacobi. And we were very involved with this. SHO amazingly did a number of student projects. There were 3 of them over the summer of 1966. And the fascinating thing is that they were supported by the Office of Economic Opportunity, the poverty program that actually Lyndon Johnson had established. So we had 3 student health projects, one in Los Angeles, Chicago, and New York. Got over 260 students. This was actually in LA. Then in '68, we had 9 student health projects around the country with 600 students. SHO organized 40 chapters with 40,000 members. We established a national office, but because of a lot of other things happening in the country, the national office closed, and really AMSA, I think, was the ultimate product of SHO. And then the other activity that was remarkable was the Health Policy Advisory Center, or Health PAC. This was created in 1968 as kind of a new left think tank here in New York. And when I couldn't go back to residency because of my legal case, conscientious objector case, I decided to join Health PAC in January of 1969. That's why we moved to New York. That's why Charlotte started at Lincoln. We published a book that's really kind of fascinating to read these days, The American Health Empire, Power, Profits, and Politics. And in '73, I decided to finish my residency because the Vietnam War was declining, and the threat of my being drafted, I think, seemed less. And Health PAC was really interesting because they, had some very interesting propositions. It said that there is an medical industrial complex, that the healthcare system is not a non-system, it is an actual system, and we'll describe this a little bit more in just a moment, and that reform of the system, we argued, requires kind of organizing from below, community and worker control. And the interesting effect of the Health PAC analysis, I think, is that it gave a legitimacy to student protest against the academic medical center. And the one of our statements in the book, The American Health Empire, is that the most obvious function of the American medical system, other than patient care, is profit-making. When it comes to making money, the health industry is an extraordinarily well-organized and efficient machine. At Western Reserve, we were given by drug companies black bags and threatened to actually burn the black bags as a protest against the pharmaceutical industry. And indeed, they stopped giving us black bags. Then students at Western Reserve, after I left, actually discovered that the university was building an ambulatory care center with separate waiting rooms for Medicaid and poor patients and commercially insured patients. They protested that, and in fact got it so that there were no longer separate waiting rooms when they finally built the building. In an interesting way, the academic medical center seemed to have more potency as the enemy. And I was fascinated. I didn't know this at all, but I found this in the archives at Cornell. And it just gives you an idea that even Cornell, I couldn't believe it, had a group of students that were very concerned about what the academic health center was doing. The department chairs putting their hands on their ears and eyes, and the dean being rapped And community worker control, very important. I guess I'm running out of time, but I'll try to race along here. Just tell you briefly about the Health Revolutionary Unity movement, and I've talked about the Lincoln Collective. What was HRUM? In March 5th of 1969, literally 150 workers seized control of the Lincoln Mental Health Services. And that was a 2-week period where they took administrative control of the program. They articulated a 10-point program that included the notion of community worker control of health institutions, free health care services and increased preventive services, open admissions to medical schools for minority students, and the unity in this revolutionary unity movement was the idea of worker community control. And they had leadership. Cleo Silver, who you may have heard, she's around today. It'd be very interesting to invite her to come and talk to you. Out of the Black Panther Party, Gloria Cruz, who was at the Young Lords Party, but down at Gouverneur Hospital in the Lower East Side. And they were linked by one of the leaders of, actually, the Young Lords Party, Juan Gonzalez. Have any of you heard of Juan? Yes, right. I mean, he's regularly on Democracy Now! Today, a radio program, and is a columnist for the Daily News. Interesting. And this is the kind of stuff they put out, the spirit of logos. To our brothers and sisters who are using drugs, this was a big problem in the South Bronx. Capitalism plus dope equals genocide. Very strong political message. And finally, there's the women's movement, and my journey in the women's movement was interesting, certainly symbolized by the book Our Bodies, Ourselves, which came out in 1970. And my wife decided to change her name back to her maiden name, actually in 1974. That was a real jolt today. But it was the right thing to do. And you began to see the importance of women leadership in places like the Lincoln Collective. And just to show you again a little bit of the health pack analysis, we felt that the problem was really dealing some with what were seen as the more progressive liberal folks in the academic health center, who argued that we were a non-system and we needed to organize a system. Well, HealthPAC felt there was a system, as I described before. The function of the health system was here among liberals to maintain doctor autonomy. We saw it as essentially to make profit. Therefore, the liberals felt that the AMA was the real enemy of change. And we felt, frankly, the academic health center was more of a problem in terms of true change. And the change agent here, where the liberals felt the health centers and the business community, we felt workers and community control. And this was symbolized by the regional medical programs, not terribly relevant to you today, but we felt by the medical industrial complex. So, in summary, the impact of social movements on healthcare. The civil rights movement, I think, had a profound effect on the desegregation of hospitals in the South. Probably the most important thing, actually, was the Medicare program. I don't know if you realize it, but up until 1966, hospitals were totally segregated in the South. But because the Medicare program had been passed, and they couldn't get Medicare money, if indeed they remained segregated, you began to see the integration of hospitals in the South. The whole notion of community control really grew out of the civil rights movement. The rise of community health centers, which we see today as being very important in delivering health care, and the whole notion of minority admissions to medical school. In terms of the anti-war movement, I would argue that it did contribute, frankly, to the end of the Vietnam War. It challenged, and does today, challenge the siphoning of millions of dollars from public health and medicine into this huge military complex. And it called attention to the threat of nuclear war and nuclear power. And we're beginning to hear more of that kind of language from environmentalists. In terms of the student movement, it truly changed the professional aspirations of a lot of us, health professional students. It challenged academic health centers to add community service to the traditional missions of research, education, and patient care. I wonder if that is in any way articulated here at Einstein. We're trying to get medical schools to say it's not the tripartite mission, but we really should have a quadripartite mission, a mission of community service as well. And yes, it led to a much greater awareness of the corporatization of medicine. The women's movement led to a new focus on women's issues, health issues, like our bodies ourselves, contributed to the rise of gender equality in medical education. In my medical school class, no more than 10% women. That was true across the country. That's no longer true today. 50% of most medical schools have women. And then the importance of nurses, social workers, and a team, such as the SINAP kinds of situations that exist today. And what have we learned from the movements of the 60s? Frankly, that transformative change requires, I think, a social movement. That leadership by young people is absolutely crucial to social change. You guys are significant and important in making social change. And I love this paraphrase of the Martin Luther King quote, right? The arc of history, he said, the moral universe, is long, but it bends towards, he said, justice, and I would say access to health care for all. Let's do a few questions.
I just have a quick question, which is, can you speak to how being an activist has impacted your career and/or patient care? If you still do patient care?
Yeah, I do.
And what do you think of it?
Okay, yeah, a very good question. It impacted my career in that I really took the health pact message, so to speak, to heart, and decided, I think this again sounds crazy on some level, but that really where the power was in terms of shaping the future healthcare system was in academic health centers in East and New York. And so I joined the faculty here at Einstein and was at Lincoln until 1977, when the Catholics said, they don't want this kind of trouble, and they kicked me out of Lincoln. Well, so I then decided to look around, what do I do? I said, and there was a position open at Columbia Presbyterian Medical Center for the director of their general medicine outpatient service. And I said, hey, this is an interesting opportunity. And so I went to Columbia, both to form their division of general internal medicine, which, by the way, very few divisions existed in the country. And there were 4 of us that went to Columbia to do this. And then gradually decided to take the clinics there and reorganize them along the Lincoln model so that there was continuity of care. Began to recruit general internists to supervise residents in the clinic, but also to build their own panels, okay? And that never existed before. So that what we could offer to patients, was both continuity of care, and then for me, what I wanted was to see that the patients were treated the way private patients were treated when they got hospitalized. And this was a big issue at Columbia because we had open-bedded wards. Have any of you been on an open-bedded ward? It's absolutely astounding. 12 to 16 beds. And what I was arguing, and that's where all the community, the poor patients, were hospitalized. And that was in contrast to the Harkness Pavilion, private and semi-private room. And we argued that at least the attending physicians should be able to admit their patients to the Harkness Pavilion. The hospital resisted that until we went in 1980 for a grant from the Robert Wood Johnson Foundation to actually build an addition, a general medicine division. And I said to the administration of the hospital, we won't be able to do this if you don't give us the right to admit patients. The site visitors came and we still didn't have the commitment from the hospital on the morning that they arrived. But at 2 o'clock in the afternoon, when we met with them, they said, you have actually gotten admitting her to the Harkness Pavilion. Was agreed. I thought the chief. Then what we did is we built 5 satellite health centers in the Washington Heights community, populated those with medicine and pediatric attending physicians, and really got very involved with delivering health care in the community. And then I got very involved with Physicians for a National Health Program in the early 90s. Go on and on and on. I decided to go, ultimately, we got a new chairman of medicine who wasn't so happy with the things I was doing at Columbia. The one thing he was willing to do was to give me a sabbatical to work in Washington as a health policy fellow, in the Robert Wood Johnson Health Policy Fellow program. But totally serendipitously, that was 93, 94. So I was there in the middle of the Clinton healthcare reform process. And I lucked out by actually getting to work with George Mitchell, who was then Senate Majority. You know, all of these things, there's so much serendipity in things that go on in terms of change, I have to say. And then when I came back from Washington, I knew I couldn't go to Columbia, so I interviewed around and got this position as Associate Dean for Affiliations at Cornell. And my mission there was to try to diversify the clinical educational experience of the Cornell students. Cornell students, you know, back in 1965, 1995, you know, essentially the big change or the big thing they did was, you know, walk across the street to New York Hospital. They might have gone to Memorial, you know, down the way, or over to HSS, the Hospital for Special Surgery. If they got off the island of Manhattan, they ended up going to North Shore Hospital, the wealthiest community on the Isle of Long. So my idea was, you know, could we get Cornell students off the island of Manhattan to the South Bronx, to Queens, to Brooklyn? And one of the accomplishments there is that Lincoln Hospital is now a Cornell affiliate. Okay. Incredibly interesting experience in 1963. And, you know, roughly 40% of our clerkships are done off the island of Manhattan. 50% of our physical diagnosis is done off the island of Manhattan. And 50% of our office-based preceptor program is done off the island. So those are the kinds of things that I've been able to, you know, that's how it influenced me. Okay. Yes, a lot of that is serendipity, chance that it happened. And I'm not sure I would ever have predicted this direction myself. That's a long answer. Yes.
I was wondering what your experience has been with community advisory boards and how they're able to solicit feedback sort of in an academic medical setting. And I guess my follow-up question is, do you think that community advisory boards are the most effective way of getting feedback, or is there a different way?
I think they're important. Obviously they have been manipulated a lot by the academic health centers, but the community advisory board around Columbia Presbyterian was, I think, an important force in getting that medical center to pay more attention to the community in which it was located. Fascinatingly, two of the really fantastic activists in that program were a couple, the Bassetts, who really were very significant in getting the hospital to move more in a community-oriented direction. And it turns out, interestingly, that their daughter, Mary Bassett, has just been designated the new Commissioner of Health for the university. So, today, the problem at New York Hospital, Cornell campus, Community Advisory Board, it's the Upper East Side. Not a great place for me to speak about the power of community advisory.
So do you guys solicit feedback from any of those other clinical sites that you were just talking about off of the island?
Feedback from them?
Yeah.
You mean in what way? We're very active in trying to, shape some of their policies, but I can't be, overly prescriptive in that sense. I mean, the way these affiliates have developed is in kind of a Commonwealth model in which the parent institution doesn't truly dictate the policies that go on in the community.
Thank you everyone so much for tuning in and listening, and thank you, Ollie, for coming up and giving a wonderful talk. I want to thank the other lead organizers, Becca Mon, Sarah Ruberman, and Kyle Whelan, as well as all of our other organizers. I also want to thank our faculty advisor, Matt Anderson, as well as Marty Grayson, Albert Cooperman, and Martin Penn for all their support. Remember to tune in and subscribe, and you'll get updates on when other lectures are added. So take care, and until next time, always remember that imagination is more important than knowledge. Peace.